All right, so in this video, we'll be looking at the male reproductive system, mostly in this video looking at the anatomy. In the next video, we'll be looking at sperm production and hormone regulation. All right, so first, the primary organ of the male reproductive system is the testes, and it is where sperm is produced, and there are several accessory glands associated with that, which we will mention as we go further. The testes are housed in a flesh kind of sac called the scrotum, and the purpose of the scrotum is to lower the body temperature or lower the temperature of the testes, kind of separating them from the rest of the body. Sperm production requires a lower body temperature, and so essentially by increasing the surface area, it allows for more exposure, thus lowering its temperature so that sperm can be created normally. In certain situations, however, if the temperature decreases, then the testes can be brought up into the body by the scrotum basically shrinking. So a little bit more about the testes. The testes are this organ on the inside. They're surrounded by these two tunics. You don't need to know the name of them. And these, there's some different septum in here, or septa, that divide the testes into approximately 250 different lobes, and each one of them contain these tubes called the seminiferous tubules. And these seminiferous tubules are where sperm is actually produced. Sperm is basically conducted through the seminiferous tubules into this area called the straight tubule, and then through this area called the rete testes, then to the efferent ductile. You can see all these tiny little tubes here into this structure here called the epididymis, which is where sperm will finish its maturation, and it basically waits until it needs to be used. One thing to just talk about, like homeostatic imbalances, is testicular cancer, which is a fairly rare disease, but it is most common in males 15 to 35. And so younger people have more incidence of testicular cancer than older. And the signs of it is just, it's a painless, solid mass in the testes. And so it's something that especially younger men should be concerned with. If it's caught early, there's a 90% cure rate in it. So it's something to just make sure that you have regular checks on that, because it's just something that's easily preventative. So a little bit about the male duct system. They're just starting with the epididymis, where we just left off. I can go back to this picture to look at that. In the epididymis is where the sperm mature. You have the different sections of the epididymis. You have the head of the epididymis up here, and then the tail down here. And you can see those efferent ductiles that are located in the epididymis. The sperm enter here, and when they enter here, they're not motile, meaning they don't have a tail like we normally associate with a sperm cell. And it takes about 20 days of maturation before they are able to swim, and they can be stored in the epididymis for several months. And then, so here's the epididymis here, and then the next duct or tube is this called the ductus deferens. Sometimes you'll see it called the vas deferens, and it's a tube that is approximately 45 to 50 centimeters in length. When someone has a vasectomy, they are having this tube cut, basically. This tube that takes the sperm into the urethra. And so it is almost a 100%, almost a 100% effective birth control method because of just cutting that tube. It prevents sperm from going into the urethra. And then next is the penis, and the penis is the male copulatory organ. One interesting thing about that is that the act of circumcision is this is removal of the foreskin on the head of the penis, and approximately 60% of males in the United States are circumcised, but only 15% of males in the rest of the world are. Which is interesting because all the studies show that there's like a 60% chance or 60% reduction in HIV risks and other sorts of infections, which with circumcision, it tends to be a healthier alternative. And looking at some of the accessory glands, there is let's get a bigger picture here. There's the seminal glands. Sometimes you'll see these called the seminal vesicle, that's what this picture has here. The seminal vesicle produces an alkaline fluid that makes up a portion of the semen, and that alkaline can counteract the acidic nature of the urethra or the vagina, and it also contains fructose and citric acid and some other enzymes, and the material produced in the seminal vesicle, approximately 70% of the semen comes from the seminal vesicle. Then there is the prostate, and you can see the prostate here. The prostate actually encapsulates this entire urethra here. It's right underneath the urinary bladder, and it contains some enzymes as well that it produces. And then there is an antigen called prostate-specific antigen, PSA, and that it plays an important role in sperm activation. And it's one of the things that gets tested for if you have prostate cancer, then your PSA levels can be high or low. We'll talk about that in a second. And then there is the bulbourethral gland, which is also produces some of the materials found in semen, and it is found here at the base of the urethra. So a couple of things associated with, as far as just other homeostatic imbalances, one very common thing is called prostatitis, which is a lot of times if a male has to see the urologist, this is mostly going to be the reason for that. And prostatitis can be caused from like a backflow of urine or several other things that can cause that. And then there is just straight up prostate cancer, which is the third most common cancer death in males and affects approximately 1 in 6 males over the course of a male's lifetime. And this is just, again, one of those things that early screening and prevention can help out a lot. They will take a prostate sample and they will look at the PSA levels in that, or they can just look at the PSA levels in your blood and they can tell pretty quickly if there's something wrong.